Well, welcome everybody to our June luncheon in this weather. I appreciate everybody coming out. And I'd like to thank Bill Woodbury, our speaker, for coming out from Los Angeles. And you're going to hear more about Bill and his lecture on enablism. And he didn't put my picture up on the slide, so I was very appreciative.
It's coming.
Oh no! We haven't watched the entire slide presentation. I've known Bill for many years, and it's an honor to have him here. I'd like to also recognize today is Jim's 24th sobriety birthday. And when we go around to do quick introductions, I have a coin. And so if you can, we'll pass the coin around, and maybe you can introduce yourself and touch it for Jim. And if you want to say something nice, that'd be good.
Yeah, I could do that.
Okay.
Something
Yes.
nice to Jim.
Say something nice. You guys can start thinking about that now. I know, Tommy. I don't know. I'd like to thank our sponsors, of course, Millennium Lab, Seth, and Sovereign Health. We have Yvette. Would you guys like to come up and say a couple words about? First, I'll let you guys get started with the introductions.
First of all, I would like to say thank you to Addiction Therapeutic Services for putting on these luncheons and giving us a chance to network together and get to know what services is out there to keep us helping those who are still suffering. Jim, I've worked with you in several different places, and you have been a big part of my life. I mean, I remember when I had to change positions at one of the treatment centers, and before I can get out the door, you had another place for me to go. And I want to grow up and be like you. I want to get that clean time you have and some of those degrees that you have, and just keep on the trail of recovery and helping those who are still suffering. You're a wonderful, wonderful person. And I mean that from the bottom of my heart. Sovereign Health is a treatment center that treats, it's evidence-based, and it has 8 different treatment centers that it treats severe mental health. So when a client is not a fit for you, Sovereign Health is a good fit. And the reason I talk about the mental health so much is because here in our part of the desert, in Riverside County, San Bernardino, Santa Barbara, you don't find much mental health treatment that is like a residential, and where they have the psychologists and therapists and all on staff right there to treat. We're licensed to treat mental health. So when it comes down to the addiction part and a client runs out of insurance, or you know how the insurance only pays for 21 to 30 days, but Sovereign Health can go a step higher with that. We also are treating adolescents from the age of 14 to 17 and a half, and that's with dual diagnosis license. We have treatment centers in San Clemente, Culver City, Utah, Arizona. Our adolescents is in San Diego. All our treatment centers are licensed. Really, I would like to talk, if you want to know more about Sovereign Health, I talk to you more about Sovereign Health after this. I get very nervous standing up. If I was sitting down, I would give you the spiel. But I want to say thank you for listening. Thank you.
Millennium Health, as I'm certain everyone is very familiar with, we do urine drug testing, medication monitoring for programs, be it sober living, inpatient treatment, outpatient treatment. Anyone where there's a need for what we do it. We're an in-network facility, so we really try and keep the costs low for patients, the co-pays, the deductibles, whatever we can. You've heard a lot about that. Suzanne and I were just talking a little bit about the other side of our business, which is pharmacogenetics. We also do a test to assess how patients will respond to different medications prior to them being written for that patient. So it helps get people on the right medications sooner, which is really cool if you're a facility and you have patients that are seeing a psychiatrist, or if they're getting mood stabilizers or depression medications, because getting people on the right meds gets them on the right track for therapy much sooner. So it's something that we haven't really talked much about, but if anyone's interested, I'd be more than happy to go in depth and get real science with you after Bill talks. So thank you very much. I appreciate it. Back to you.
Thank you, Seth. I'll take that. Okay. So, Jim, I love you so much. Thank you for all the almost 14 years we've been together, that I've been with you during your 24-year journey of sobriety. And you're my best friend. and I know there are going to be many more years. I love you very much. And back to Addiction Therapeutic Services. So Jim and I started that program. It's one of our babies. And we're just a block away. If you guys haven't taken a tour, come over and visit. We're an intensive outpatient program, CARF accredited. And we're working on our Joint Commission this summer. And we just signed the Blue Cross contract yesterday. So we keep moving forward with everything we're doing. For best practice, we care a lot about our clients, of course. Jim took the cake with them first this morning, and then now with friends afterwards. So it's a blessing.
And, Jim, do you want to say a couple words since it's your turn?
Okay.
And then this is going
Wow. I've been blessed in my recovery, and I want to thank everybody for coming out, and I want to thank Bill for speaking. Every year it's either at a meeting or wherever I'm at, I put my coin out so people can put a little bit of luck on it. I've done that every year for 24 years. So we're going to do that again. I love being sober. I love my life right now. I am blessed and I have a full life, wonderful family, good friends. I was one of those people who were, I was one of those pain in the ass clients. You know, they get better. You know, reluctant, for the reluctant to recover. And my journey started 27 years ago, 28 years ago. Over 30 years ago. Anyway, so when you have those reluctant to recover clients, love them, you know, find common ground, because it does work out. Recovery is a great thing. And with that, I will pass. Thank you.
Thank you, Jim. I'll take that one. Thank you. The shirt he has on, I hope he doesn't mind. This is his uncle, Barton? Burton. Okay, keep calling him Barton. He said saved his life because he wrote him out of his large will.
Yeah.
And that saved his life because he was an addict. So talk about not enabling. Yeah, it's good. That's the unenableism shirt.
There's a brand of clothes.
The uncle strips it right there.
Hi everybody, I'm Chelsea Ramirez and I'm the Director of Admissions at ATS and also Jim and Josie's daughter. And this is a special day for us and I'm glad that we get to share this day with Jim. 14 years, so that makes me 12 that he's been in my life, right?
Yeah.
Well, I was hidden for the first couple.
Yeah, that's
Yeah,
what
I didn't meet him for the first couple years, so she had to be sure, right? Well, we're so blessed to have him, and I know this journey of me being in this field, and I've learned a lot from Jim, for sure. He's awesome at what he does, and I'm glad that he's my father, and also I get to work with him. So, congratulations, Jim. Happy birthday.
give it to him.
Oh, I'm not giving it to him.
Oh, man.
Yeah. It's a roast.
My name's Eric. I also work at ATS. I'm a tech there. And, well, Jim, I'm blessed to have you in my life. And I'm grateful for you, Josie, or else I don't know where I would be. And, well, happy birthday.
My name is Samuel, and I work for ATS. I just help out around the office. I'm currently employed by my parents, who are Josie and Jim. Jim, you know, I'm very grateful for you to be in our lives right now. You know, I look up to you. You know, you gave me someone to look up to. You know, like my father wasn't really that much of a man to look up to, and then you came through, and it's like now I have someone to look up to. So, you know, when it comes to sobriety and wanting to, you know, further my life in a positive direction, you know, you inspire that. So happy birthday. I'll pass it.
What a privilege to be speaking on your birthday, Jim. You and Josie are some of the good people in this field. You have wonderful hearts. You care about what you do. You have a program that truly is there to bring people through this tough time, like you said, Jim. Very grateful to be here this day. I have a birthday coming up at the end of the month, and you know, they're just as special to me now as they were in the beginning. And every year it just seems to get more and more magnificent. And I know you would say that, Jim. It's an amazing ride, isn't it? Yeah. So thank you. I'm honored to be here.
I don't want to roast you guys.
Too late. Too late.
Guys, this is like really uncomfortable.
I could have roasted
Well, I really feel that the all the services you provide on the community group operations you provide to the community reflect your openness and your willingness to step into the people's place and help them. And so I'm very thankful for you guys.
And Albert, you have one.
Albert, the clinical social worker.
Hi, I'm Samira. I'm with Addiction Therapeutic Services. I'm the COO there. So I've only just started getting to know you, Jim, and in the last few weeks, I have already come to very much appreciate and admire your genuine and passionate commitment to client care. And being new in this industry, having you and Josie to look up to and learn from is really an honor and privilege, and I mean that from the bottom of my heart. So thank you. Happy birthday.
Hi, my name's Jerry McDonald. I'm with the Beacon House, the beautiful Beacon House on the Monterey Peninsula, right next to Carmel, Pebble Beach, and the city of Monterey. So please come and visit me sometime.
Okay.
But Jim, I was here in the desert when Jim came to the desert. And we were colleagues for a number of years at the same place in the desert. And the greatest thing that happened was that when he left us in the desert, he stayed in the desert. And because you've stayed, look at all the wonderful things that have happened since then. So 24 years is significant. And I just want to say thank you for all that you've done in the field and all that you've done in your personal recovery that obviously people can see and appreciate. So thanks, Jim.
Tommy Vaughn. I represent his house, which is a men's treatment program, detox, residential, clear to sober living. Also represent New Creations, which is a women's program, provides the same services. Inland Empire, up the 10 freeway, we're Upland, Ontario, Rancho, Colton and Redlands. Brochures on the table, please pick them up and check them out. Jim. All right, here we go. Okay, I'm gonna keep it real. But no, that's what I like about Jim. You know, first day we met, the guys are real. It's not, you know, you get what you see. Kind of like with me, you know, I'm kind of same way. We're somewhere together. Man, me and him hang together because, you know, we're kind of out of the same mold, I think. You know, I know back in the day, before we got clean, we'd have partied. I know it. You know, and today we get to party in sobriety and recovery and help other people. And I'm blessed to know you. It's an honor and a privilege. And you know, 24 years is really significant, like Jerry said. And hopefully I can make it to 24 and keep plugging away also. Thank you very much. And these coins are really valuable to us as addicts and alcoholics. Thank you again for being part of my life.
My name is Jeanette, and I'm with Addiction Therapeutic Services. I'm the program director there. And I have the privilege to work alongside Jim. And we have a very good relationship, I think. It's interesting because I think all the people that I come across in my life, it seems like you get put where you're supposed to be. And definitely I am where I'm supposed to be. And when we say that, when you made that statement about, what they've put into what he's built, it truly is a reflection of who he is and who Josie is. They're very caring and loving people. And, Jim, you make working there a lot of fun. I love you dearly. Even though yeah, I love you dearly. We're good people. Yeah, not a roast. Not a roast. But you know what? If you don't know Jim, you have to get to know him because he's a good man. He's a really good man. And for me, it's we always talk about the number of the years that we accumulate, and it's really the quality of what you put into your life today, the moments that you share with other people, and the significant events that happen in your life today, whether big or small. They mean a lot. You mean a lot to me, Jimbo. Love you.
So I'm going to go back old school. When I'm going through the rooms, we pass the coin around and we put something in that coin to give you strength. And what I'm going to put in this coin today, Jim, is prosperity. Prosperity in your walk of life. Keep the faith, keep doing what you're doing, and keep giving the hope to those who are still suffering. So prosperity.
I'm Sharon Rain. I'm also with Addiction Therapeutic Services, coordinating outreach. And I wouldn't have a job if you weren't sober, Jim. I am so happy to be here today to honor your 24 years, one day at a time. You are a unique individual, and I really appreciate the heart that you keep developing and adding to, and along with your knowledge. So thank you for being you and keeping it one day at a time.
Hi, I'm Michelle, and I am also with Addiction Therapeutic Services. I'm the spiritual care counselor there. And I get to do the spiritual groups and the spiritual retreats, and it is an absolute joy for me. I honestly do what I love today, and I work with a team of people that also do. And so thank you, Jim, for creating that with Josie with so much love. It's so heart-centered there. I really feel like I'm with my family, and that all of the clients there are so loved. And in regards to Jim's work, I have personal experiences with the clients. I have personal feedback from them that they share with me about their experience with Jim. And so just yesterday, one of my clients, because I also have a sober house out here for women that's called Cielo, and it's in Sky Valley. It's really beautiful, and that's where we do the retreats once a month too. She was sharing with me how, first she shared with me on another occasion how Jim's her favorite person. And then she shared with me that Jim said he loves me today. But she's getting ready to go back home, and she's grown so much, and I know he sees that in her like I see that in her. But you could feel her self-esteem and her joy around it, like genuine. Because that's what I feel like Jim and Josie really bring, is that, ability to be transparent and honest, and just really forthcoming in Jim's case, I must say. And so, I like what someone shared, you get what you get the truth. You get what you see? Yeah. So, yeah. And so anyway, so thank you for allowing me to be a part of the team there. It's truly an honor. And really, really, it's a big deal, another year. And thanks for what you do.
Hi, I'm Dr. Ray Montella. I also work as the clinical supervisor at ATS. And, you know, when you first meet Jim, you're not sure if you like him. But as you get to know him, you really can't stand him. You knew I was going to do that, right? But no, out of all the people I worked with, Jim, you are definitely one of them. I really appreciate that. Okay. You know I love you. I love you. You're my brother from another mother.
Hi, I'm Aaron Byer. I'm with Alchemies. I represent the Vivitrol. So the brochures over there. If you're interested, talk to me later. But I believe that people don't come in your life by accident. I think Jim's one of those guys where we all are here because we know him. It wasn't an accident. So I've known him for about 4 years, and we sure do play phone tag sometimes. But when I get his call, I always pick up. I love it. So I actually hung up on my dad to take Jim's call the other day. So that's got to say something. So love you, Jim.
Hi, I'm Richard Lookfield, a family therapist. I have a practice in Mill Valley, California, and in Palm Desert. I do experiential therapy. I'll be presenting in 2 weeks here at the luncheon. Happy birthday. I observe from the periphery. You know, I come down every second week, and I've bumped into them here and at conventions, and I've never seen a couple doing what they're doing so graciously. And my vision is that they're on a bicycle built for two, Josie's steering and he's pedaling.
You'll hear more about that when he speaks.
Hello, my name is Hedley Green and I'm with Recovery Channel. We're a full-service marketing agency. We also do UR and billing as well. I've had the pleasure of knowing Jim and Josie for only 3 years, so I don't know any of the bad stuff. So I can't really roast them very much. But I always found Jim to be such a perfect gentleman and such a nice person, really. So congratulations, Jim, and I wish you another 25 years, 24 years.
Hi, I'm Suzanne Jesse, consultant for treatment centers offering anxiety solutions, and also delighted to be working with Dr. Lai now with the Vivitrol and, of course, the naltrexone implant. Jim, congratulations on 24. Your life and your contribution to recovery is just incredible, and your union with Josie and what you guys do in recovery is really a great example of what it means to put the pedal to the metal and make a difference in this world of recovery. So I'm delighted to be here today. Thank you for this beautiful event.
I'm David Mallow with Recovery GPS. We're recovery coaches, do monitoring, transportation, and next week we will be coordinating the alumni department for ATS, so thank you. Jim, I'm always thanking Jim because 10 years ago when I started my journey into recovery, one of the first people that I met in my treatment center was Jim. And I was really angry and really confused and really fearful. And Jim, you were really kind and considerate and loving to me, and for me, that's exactly what I needed at that time, and I appreciate it. And I don't know where your coin is, but the mojo that I want to put into this and go old school like you did is I want to wish you that you get comfortable in accepting compliments because you deserve it, and I love you.
Hello, my name is Brigitte Phillips and I'm with Safe House of the Desert. We're a shelter for youth in crisis in Thousand Palms. We also have a drug and alcohol program there at Safe House, again 11 to 17. And I met Jim and Josie about 2 years ago, and the first time I met them, I don't come to these luncheons very often because I'm always busy with youth, but the first time I met them, they're very warm and great energy, and you guys really have done a lot of good things. I've heard a lot of good things in the community for what you've done for some of the clients you have, so keep on going and doing what you guys do, and I know you're really loved throughout the community, and with this coin, just keep on going. Thank you.
Good afternoon. My name's Don Bola. I'm an alcoholic.
Congratulations, Jim. One thing that stands out for me is how I met you, which was through Josie, which was through National Association of Drug Court Professionals in Anaheim, and I met, and I was brought to your booth by a person I had been talking to across the room, and I was looking for some help for a female alcoholic, and he said, well, you should come talk to these people. And I looked up and I saw the poster, and it's like, wow, 559, I've been there. You know, and then we kind of started communicating, and I'm grateful for these lunches, and keep coming back.
Hi everybody, my name is Julie Hilstead, and I'm in the state of California. I'm with Partner Rehab. This is my first time here. I'm sorry I have not met Jim or Josie until today, but I do have your coin. And congratulations and happy birthday on your 24. That's amazing. Thank you very much.
Hi, my name is Emerson McGee. I'm the program director at Serenity Palms in Cathedral City. First of all, happy birthday. Congratulations. We're a 24-bed co-ed facility, JACO accredited. We also have programs in Alberta, Canada, and Newfoundland. And we have some brochures at the table. So pleasure to be here. Thank you.
Hi, my name is Sylvia Rive. I'm a therapist intern. I'm also with Serenity Palms. I don't have the pleasure to meet you, but I'm going to put in your phone back.
Hi, my name is Salim Nirali. I'm a clinical director at ATS. The strength of any organization is integrity and genuineness, and that is what ATS brings. And it is also the characteristics or character of a person. Jim, you are genuine and you
My name is Paul Clowers. I'm with the Kilby Center for Recovery. And Jim, happy 24, and here's to 24 more years.
Hi, I'm Suzanne Stradley, and I'm working with Dr. Albert Lai. I'm doing the naltrexone implants. And Jim was so gracious after we first started and came to the desert that he actually came late to meet with Dr. Lai. And I can remember him saying, I don't know why I'm doing this, man. This is like way past, and I've got to stay here. It was, he was a little, but then he met him, and it went great. And I just appreciate the support that he's given with Dr. Lai and what we're doing, and just reaching out and then opening up also your center to have us talk to your clients. Thank you very much. And thanks to Kilby Center and Suzanne, who's also supported what Dr. Lai is doing with the naltrexone implant. So thank you. And happy 24th. And this is being sent with lots of prosperity and joy.
My name is Johnny Courageous. I'm a counselor at Serenity Palms in Cat City. And Jim, I've known you for a while. I haven't seen you in a long time. Happy birthday, my friend. And about the facility, it's a 12-step based program. We also offer CBT. It's we dual diagnose. We have therapists, counselors at the facility. It's a good facility. I have cards. We have brochures. Pick them up so you can get an idea of what our facility is about. Appreciate it very much. Thank you. And happy birthday, old son.
All right. Thank you, everybody, for sharing this time with us for Jim's birthday. And now we're going to eat. Hopefully we can finish by 1:30 so that we'll stay on schedule for Bill to speak from 1:30 to 2:30. And I just wanted to, of course, mention our next luncheon. I didn't realize this is 2 weeks. July 10th. So please mark your calendars. Richard Lipfield will be speaking, and you just met Richard. He's been coming to our luncheons. Experiential therapy in recovery. So it will be a little hands-on experiential trauma. He's asked that everybody next month kind of sit closer, and we're going to have a nice time. It is next month. I'll give it that, but it's literally 2 weeks. I think it's because of the holiday, 4th of July, and vacations. I know my daughter is having a baby probably that week. so the 14th. So anyways, it was kind of around all of our holiday schedules. So I hope to see everybody there, and we'll enjoy that. Are they looking to get food? Okay, so everybody enjoy your lunch, and then we'll reconvene in about 30 minutes.
I just want to thank everybody. I do want to talk a little bit about our team. We have a very passionate group of therapists, counselors, and we're not afraid to argue with each other when it comes to patient care and what's because we all see them a little differently, and it's a wonderful working environment, and I'm blessed to have people around me who are around me, and I want to thank them, and I'm done. Thanks.
Love you, Jim.
So I've known Bill for how long, Bill? Maybe quite a few years. And we first met when I...
Loma Linda or before?
Loma Linda, yeah. So it's been probably
20 years.
Close to 20 years that I've known Bill. And he's wonderful. I know, can you imagine? We were so young back then.
Wow, yeah.
Oh,
couldn't drive. Neither one of us could drive.
We couldn't drive when we started working in the field together.
Amazing.
But I remember Bill's passion back then, and I'm sure it still is, was the older adult program.
Yep.
And we were starting that there at Loma Linda, and then when we went to Hemet, we were moving to Hemet, and he helped us with ideas with the older adult program. He also has run his own programs. He's been in the field since 1988, so that's many years, and he's trained on almost all the modalities of intervention, Storty, Johnson, and Gorski for relapse prevention. So he has many different certifications as far as specialties from a counseling perspective. And he was program director at the Newfound Life program up until this last year in April, when he decided to start his own company, which I'm very excited about, called Bridging the Gap, and that's what he's going to be speaking about. He just finished his book. It's under the final edits, I believe, and that's titled Enablism. So this is one of the first lectures that he has out there for his regarding his content from his book and his passion for working with families. So I'd just like to, for you guys to help me welcome Bill Woodbury.
Thank you. Rosie.
It's always interesting to introduce somebody you've known for a long time, huh?
Yeah.
Yeah, I always like that. Yeah. Like, here's all the official stuff. Let me tell you about Bill.
Yeah.
So, my name is Bill Woodbury. And,
Bill W.
Bill W, yeah. And I'm really, like I said, honored to be here to celebrate Jim's birthday. That's exciting. My passion is and was and will always be for the hurting and people that are in need of recovery from addiction. And in 1988, I started working in the field of addiction at the care unit. If anybody's old enough to know the CompCare Corporation. And most everything we do today came out of the CompCare. We still use a lot of their material. Came out of that care unit corporation idea. And they were huge. They put me through school. They paid for all the certificates, the education. It was quite a training ground back then. And Dr. Michael Stone was my first program director in Orange. So I caught the passion from some really great people back in the field early on, and have been in many different positions over the years. And like Josie mentioned, the older adult population in 1997, I was a program director at the Share Unit at St. Luke Medical Center in Pasadena, and I was noticing that the older adults that we were getting in the treatment program were being labeled as non-compliant. And that really wasn't the case. I found out that they just didn't belong. They didn't fit in with a lot of what was going on, keeping up with the pace, and the ideas and the information was coming so quickly. And that was in 1997. You can imagine how much different it is from 97 to 2015. So that still is a passion of mine. I unfortunately or fortunately knocked my head against that wall many years trying to get a program open trying to get somebody to back the idea of an older adult program, and it just hasn't really caught on, and it's still sad. There's very few programs that actually specialize in the older adult. An older adult, I mean, above, I'm an older adult now, I'm 62, so, older adults moved for me. It's now 72, and then it'll be 82, and, just keep moving up. I'll be treating people in their hundreds at some point, I guess. So that's still a passion of mine. It's something that I think it's going to be, it's maybe finally come into with the boomers. Maybe somebody will take the leap of faith, one of these treatment centers, and start a specific older adult program. And I know that Hemet has got one going, and there's a beautiful one out in Florida that I spent some time at. That was the model that I learned off of at Hadley. And so, they're around, but it's still something I'd love to talk to anybody about. I can talk about the older adult program all day and all night. About 5 years ago for me, I was working at Newfound Life, and I started seeing a change in the clientele. And I started noticing a lot of 18 to 25, 18 to 30-year-olds coming into the program. More and more and more. And they were sicker and sicker and sicker. And what was happening is, in my estimation, is we were seeing very high consequent drug use, heroin use, very high consequences in the drugs they were using, coming from very low consequence lifestyles. And that was different. When I was getting sober, heroin wasn't introduced, I didn't get into heroin until way late in the game for me. And I'd been on the streets, I'd been around, I've dealt with a lot of life issues and problems and jobs and all the crazy stuff that happens before I got introduced to that. These are 18 to 19-year-olds that pretty much have been taken care of, maybe even enabled by their families, to the point that they really have had no consequences in life. And then they get involved in the pills, and then when the pills started being harder to make into the IV drug, then of course the marketers out there, the dealers who are marketers, said, I got something that's even cheaper, and you can try heroin. Have you thought about that? And heroin is taken off. We have an epidemic now. So what's happened is, in the work that I was doing at Newfound Life, I was doing a lot of family work with what is known as the helicopter parent, the over-involved parent, the one that was very much making decisions in a way that they were being responsible for their young adult instead of being responsible to their young adult. And they were having problems breaking away. And they were becoming more and more demonstrative and emphatic, if you will, about controlling their loved one's treatment. So I was doing a family presentation, and what happened was, I was doing a family presentation. In the middle of the family presentation, a word came to me, and the word was enablism. And enablism, I started saying, instead of saying enabling, I started saying, well, the family seems to be dealing with enablism. They're having trouble separating themselves from their denial, from their control issues. The ism, the I, self, me that we've known for years that the addict alcoholic has dealt with, is very much alive in the family. So it was off the cuff after the talk. I went back to the office, Googled enablism, it didn't come up. It's not a word. So it's now a word. I trademarked it. So enablism is now a word. And then from there, I started doing more and more looking at the word and what it meant, and going back and thinking about those wonderfully simple, basic truths of recovery, the isms that we're all trained on and we understand, and seeing this connection, this bridging the gap between the addiction-ism and the enablism. So what happened is this word started taking shape. And the definition that I've come up for this word is permitting the addict's using behavior to continue even into early recovery. Now, you're going to find out as we go through this that the family's not doing this out of any malice. They're doing it out of a survival. They're doing it out of a way to get through another day with very, very inferior, confused coping skills. So this allows the enabler to feel better about themselves. The family members feel better about themselves. sometimes even at the expense of the recovering alcoholic. Again, not because they mean to. How many times as a clinician that I would be talking to the parents, trying to talk the parents out of doing something with their young adult? Well, you know, I found out that they really weren't young adults. They're late stage adolescents. So that I started seeing them more as late stage adolescents, overly dependent upon their parents, and their parents are overly dependent upon them. So this I, self, me, this behavior fits into this denial system of a very unbalanced family trying to survive, trying to get up and get through the day. So as I started gaining this information and writing it down and doing PowerPoints, like Josie mentioned, I just finished a book called Enableism. And it's all of the work I've done over the last 5 years, and it's for family members. It's really not for the clinicians. It's for family members. It's for family members that are struggling. They need some simple, real-time ideas that they can wrap their head around and they can take out and use. A lot of what we're going to go through today, we've all been trained in. But for some reason, and I've done a lot of family lectures over the years, it misses the mark oftentimes with the family members. How many times have I had family members say, well, I went to Hazleton when my son was in Hazleton, and this is his third program, and we don't need to go back. It's like, well, yes, you do. Your denial is even deeper, just like the addict's denial is even deeper. The similarities are amazing. So, you know this one. You've seen this before. This idea of the homeostasis, this idea of balance. And if you take the alcoholic and addict out of their family system, and then you bring them back into the family system, what happens is you're bringing them back into a broken family system. And the only way the addict can survive is to reattach to the family in the old way. So what enableism is teaching the family that everybody got sick. I have a story that I often tell here that it's like if somebody comes into your family and they have a cold and they get the rest of the family sick. I know when this happens in my family, one of the first things we do is we tend to blame the other family members. You know, we blame the guy that brought it in. It's your fault I got sick. I caught my cold from you. Well, I caught my cold from you. And everybody's blaming everybody else for the cold, right? But if the person that brings in the cold goes out and gets some medicine and gets healthy, but the rest of the family stays sick, what's going to happen when that guy comes back into the family with all nice and fixed up with his antibiotics or whatever he has? He's going to get sick again. And the cold keeps getting passed around over and over again until there's some kind of break in the understanding. So that's the idea of this. It doesn't happen in isolation. It happens in a family system. The family gets sick. Family members either look at themselves or to another to find blames for their problems. In order to find the solution, the entire family, to the best of our ability, must accept responsibility for the work of recovery that lies ahead. The entire family, to the best of our ability. I understand it's not a perfect science. Sometimes some family members are not able to come or willing to come or, God forbid, sicker than some of the patients you have. So it's as much of the family as possible. And remember, this is longevity. This isn't it's a chronic illness. It's not an acute illness. So we're looking this as a long-term solution, is what we talk about in the book. A difference between the addict and their family members has long been discussed. For years in the field, we have discussed the differences in the alcoholic addict and their family members. Family members have certain issues in the family systems. Addicts have something different that they deal with. In fact, when I teach at Centaur Colleges, where I teach part-time with counselors, we still teach that you have to teach family systems and you have to teach the addiction process, that there's differences. There's more similarities than there's differences. And the more we treat the similarities, I think the better off we're going to be in powering a solution. So that's what I want to talk about today, is the similarities. And these similarities I see here, the idea of the denial patterns, keeping secrets, and overcompensating. There's a lot of overcompensating that's being done in the family members. Again, being responsible for instead of responsible to. The idea that somehow if I control it, it's going to get better.
and I've got to fix it. It's my responsibility. So let's look at denial patterns and see how that plays into enableism. So the ism is based on this need, this intuitive need to survive. Denial patterns, we know that denial is in all of us. It's our emotional immune system. We were created with a certain amount of denial in us to get through trauma, to get through difficult situations, to, get through work. A lot of times when we're overwhelmed, I mean, we use denial all the time. We minimize, we rationalize, we blame, we explain. It's just a natural human process. So we're not talking about the normal kind of healthy denial that we all suffer, or all deal with, I should say. What we're talking about is the family that's suffering with denial. They've become dependent upon denial. They use it as their day-to-day breathing exercises to get up and do what they have to do. They minimize, they rationalize, and we'll talk about that. So over-reliance on denial is the problem. All involved appear selfish and self-centered, and it makes it very difficult for anybody in the family to find solace or peace with each other because everybody is so selfish and self-centered. Denial happens very slowly, we know that. We know that the entire family system is often unaware and has trouble dealing with denial. So each family develops their own kind of style of the ism. So let's look at how denial works. I love this little joke here. My desire to remain in denial is at odds with my desire to remain sane. And lots of times there's a lot of feelings of insanity in the family. So avoidance, that's a very common problem with a lot of the family members that we deal with. They will talk about anything but the real problem. The ism grows when you don't talk about the problem. When you deny the problem, the ism grows. Minimizing and rationalizing are twin sisters. So there's always a way when you're living in that survival, the day-to-day family members, where mom and dad have got to minimize and rationalize, where the husband or wife have to minimize or rationalize their feelings. There's always somebody that has it worse. There's blaming, there's comparing. All of these things are working in conjunction with each other, driving the wedge between the family and the addict. The addict has their own set of isms, and the family has their set of isms. And those isms, as they grow, drive this wedge between the family. Unless the family starts to understand the work that's needed to be done, the idea of the freedom that can come when they accept the change necessary, it's very difficult to treat the addict and send them back into the family system. And most of the families that I see that we're treating now are heavily dependent on their family. Even to pay for sober living, even to pay to go back to college. Who's going to pay for all this? It's the family. And sometimes what happens is the families will go ahead in their denial, and after a course of treatment, and I'm not telling you anything you don't already know, they'll pay for a car, they'll pay for an apartment, they'll set them back up in college, everything will be going along fine, the parents thinks the problem's over, they go back into their active denial, the addict minimizes and rationalizes their behavior, and there's another problem. Because this is not an acute disease, it's a chronic disease. The second one, the similarity, has to do with keeping secrets. Each person dealing with their ism depends on the keeping of secrets in order to survive. Keeping secrets are an integral part of survival in an unbalanced family, in a family that's suffering from an ableism. These secrets often lie right below the conscious, They're not really in the cognitive level, they're in the behavioral, they act out on it, they act as if it is true, even though if they're confronted on it, they will deny it. So it's not usually in their cognitive area, it's usually in the area of the mind that's in the reactive mind, where they're just surviving from one day to the next, much like the addict. And when these symptoms, these secrets grow, and there's a beautiful saying in the 12-step movement, that we're only as sick as our secrets. And that's one of the best clinical lines I've ever heard, is you can tell a client is, we got to work on those secrets. If those secrets are not dealt with, they become toxic, and they become a shame-based delivery system. where everything works out of that. And the ism thrives on this shame-based secret. It festers, it grows, and it becomes toxic. And you start to see this toxic behavior growing in the family. These painful feelings cause these problematic behaviors, and they cause acting out in the family. So the family wants to survive, so they'll look the other way, they'll pay the ticket, they'll do what they need to do, they'll call the teacher, they'll overreact to something in order to keep the family system in some kind of functional movement based on their fear and survival. So this whole system becomes toxic, and everybody in their own ways believing that it's hopeless. There's a sense of feeling shamed, secretive, surface conversations. There's not a lot of sense of deep meaning. So there's a loss of love, a loss of respect for each other, and it's very difficult to find happiness in this. This chronic sense of unworthiness and inferiority results in hopelessness and despair, becoming numb and disconnected from life and those closest to them. And in the book, I talk quite a bit about this disconnect that happens in the family and this inability to be honest about your feelings, because everybody has gotten so afraid and stuck in their own survival, secretive lifestyle based on the power of denial. The third one is overcompensating, because that's not oftentimes what you want the family to look like. So a lot of the families that you see out there, they'll try to put on the happy face. They'll try to look good. They'll try to have all the information. They try to have the answers. They want to fix it. They want you to fix it. They want us to fix it. So somebody's got to fix this problem. Usually by the time they come to me, they've tried to fix it in every way possible. And what they found out is they can't fix it. And that leads to a resentment. It leads to a poisoning of the family system. So the family system is becoming so toxic that it is poisoned oftentimes by the time they get to us. And people are so afraid and so stuck in that survival fear that that's sometimes why you see them hovering over the helicopter mom, the overreacting that goes on with a lot of the parents. They're doing it out of a fear. They pick up the newspaper every day, and what do they see? Another overdose, another death. They're in treatment, and they hear, yeah, one of the guys that used to be in this treatment program, we just heard that he overdosed and died last week. And they're telling their parents this while they're in your treatment program. And their parents are just panicking more and more every day. And yet they're, instead of coming closer to the solution, they're backing farther away from the solution. And instead of it being acceptable for them to get help, they start walling off and saying, you need to fix my son. And then when the son calls and says, I don't like this place, they don't have a private yoga coach, and we don't get to go to Disneyland every other day. Sometimes the parents pull them out of treatment because they get afraid. And they're so afraid that their son or daughter are going to die from this illness that they play right into the sickness instead of into the solution. So they overcompensate at this point when they're in treatment. They start, unfortunately, to meddle. They start to get overly active in the treatment process, not because they want to obstruct anything, because they don't have any other coping mechanisms. It's the only thing they know. The ism has overtaken them. The I, self, me, survival, denial-based ism has overtaken their ability to think. So recovery cannot be truly experienced when overcompensating is relied upon for survival. And again, it's that survival mechanism is why they're overcompensating. This is why they're doing it. And they can't come out of the problem. They're stuck in the problem. So we've talked about the ism in denial. We've looked at the denial patterns of the avoidance, avoiding the problem, and then minimizing and rationalizing the problem, and then dealing with the comparing that other kids, other young adults have it worse than we do, and then the last one, which is the idea of blaming. It's got to be somebody else's fault. At first, it's their peers' fault, oftentimes. Then it's their fault as their parents. It's the divorced parents' fault. And then it's the treatment center's fault. And then it's this program didn't work because they relapsed. And then it's this person's fault and that person's fault. And just like the addict and alcoholic can't get better until they run out of people to blame, well, the family can't truly accept the solution into recovery until they run out of people to blame, including themselves. And they start to accept the solution rather than run from the solution. This brings me to another thing that came up a number of years ago. It's interesting that you actually can find people carrying mattresses on Google. You know, I Googled in people carrying mattresses. And you know what came up? People carrying mattresses. So I call it the mattress theory. And the mattress theory is typically when your parents or people that are in the control seat, husbands, wives, whoever it is, they're going to rescue that loved one. And they walk around Palm Springs, LA, Long Beach, wherever they're at, carrying this mattress on their back. And what they do is every time the addict starts to hit some kind of bottom, mom, dad, brother, sister, husband, wife, throw the mattress down and they hit the mattress. I'm a good parent. They didn't hit the street, they hit the mattress. They didn't hurt themselves. They get up, they really didn't have a lot of consequences, so off they go again. And I got to chase them around with my mattress. You know, that gets heavy carrying that mattress around with them. So the family mattress is created to fix, to rescue. Family members find themselves running around frantically in an attempt to anticipate the next problem. They have no time for their own life. They have no time for their spouse. They have no time for anything because they're running around. You know, it gets heavy carrying a mattress on your back. You know, you start to run out of steam. And again, by the time they come into treatment or by the time I get in front of them, they usually they need to see a chiropractor because their backs are a mess. Their emotional backs are a mess because they've been fixing and rescuing and controlling and saving and doing everything they possibly could for so long, not because they're bad people, because they're trying to survive. They have an ism, the I, self, me of survival. The denial has become their thinking mechanism. It's how they think. They wake up every morning trying to figure out a way to control this out-of-control drug or alcohol problem that somehow has infected their family, and they don't know what to do about it. So this fear of losing them, and again, they pick up the papers, they turn on the TV, they see Dr. Oz, they watch that show Intervention, they do all these things, and it looks horrible out there. It's a pretty bleak environment when you see what the world says about addicts and alcoholics, and they're scared to death. So why wouldn't they run around Long Beach or Palm Springs with a mattress, follow their kid to Florida, spend their inheritance, take all their college money, and yet continue to, okay, it's over now. Let's put them in school. Let's buy them a car. Let's do this with them. Let's do that with them. It's all over. We're all going to be okay now. You know, but I'm going to keep the mattress in the closet just in case. And sure enough, there's a problem. One of the things I see with a lot of these late-stage adolescents is they've never learned how to fail with any grace. They have been monitored and watched and over-cared for all their life. You know, they have entire Little League programs now where they don't keep score, and everybody gets a trophy. So the fifth-place team and the first-place team get the same size trophy. They never learn how to fail with grace. They've always had somebody throwing a mattress. The kid gets a bad grade at school, the parents go down and rescue the kid, instead of saying maybe he needs to study more. It was a problem, it's now an epidemic. And there's a number of books written about it, there's a number of theories that the therapists, doctors are talking about. We have a whole generation with the millennials that have been spoiled. And they're enabled. They've been enabled so long and cared for so well by us that we took an important lesson out of their life. We took that ability, what I call to fail with grace. The ability to get up and try again. That there is a second place. And that's okay. It's really all right. Not everybody gets the first place trophy. Life will be okay. And you learn balance. That's what recovery, what you guys are teaching them. That's why they come here and I know every program I've worked in, we have certain rules and regulations, and if they do things, there's consequences. You know, this is very foreign to a lot of our 18 to 30-year-olds. They've never had consequences for their actions. They're shocked when you took an hour off their pass. They're mortified because you took all of their clothes out of their closet that were all rumpled and messed up and put it on their bed and told them they need to do their laundry and put their clothes away. You might as well lock them in a closet for a day in their mind, because they've never had these simple life lessons. And it's impacted by this idea of the ism, this self-driven survival by their families. So the grace of acceptance is so important in recovery. Acceptance is how I based my recovery work for at least the last 20 years. I call it ABC, acceptance-based counseling. And there's two forms of acceptance. There's the acceptance to accept things you can't change. And then there's a most important part of acceptance, which many people miss, and that is the ability to change things you can. But I can't change a thing unless I accept I need to change it. And that's the purpose behind the ism. That until I accept that the change is needed, and I'm not going to shy away from the hard work that's needed, then I can make the changes necessary. And that's behind all this. So another idea of ABC that I was given was the idea of acceptance, believing, and creating. ABC. It is really as simple as ABC. Now, when I say simple, anybody that's around recovery knows, what do we always say? It's simple, but it's not easy. Okay. Another thing I observe over the years is we like easy. We don't like simple. We want complicated but easy. A simple solution is oftentimes put to the side. Oh, that's just too simple. Oh, it's got to be more complicated than that. You mean if I do this, I can't be that simple. I'd much rather pay for somebody that complicates the heck out of me rather than tells me to keep it simple. I feel like I'm getting one of my money's worth if they just totally baffle me, rather than keeping it very simple. And the families need simple. They need first to accept that there is a need for change. They need then to have us help them believe that they can change. And most important, we all need to be creating a new family system together. We need to be showing the families, telling the families that it is a simple solution to live in a healthy family system. It's not easy. And so it flies in the face of iPads, iTunes, IIIs. I can Google the world now. I don't have to work for anything. I've got, everything's at my fingertips. There's a wonderful book I would recommend called Artificial Maturity. And the writer talks about this millennial generation and the generation coming up behind them, that they have these, what they think are life experiences, when in fact they are artificial. They have been created out of easy instead of created out of simple, yet sometimes hard. There was a wonderful saying Margaret Thatcher said many years ago, that sometimes you gotta fight a battle more than once to win the war. And I think with families, sometimes they give up. They lose the battle and they quit. And they throw in the towel. I know the addicts and alcoholics do. They throw in the towel. That's why we don't give up on them. But funny, we tend to give up on the families a lot of times. Well, they don't want to come to family. Well, they did go to Betty Ford. Well, they did do this. Well, we don't know about it. We back off a lot of times. And unfortunately, the reality is, I was a program director for many years. I know the reality. Who usually pays the bills? The family. So sometimes we ourselves have to look at where we're at with our denial, our minimizing, our rationalizing, our blaming, our explaining. When we have these conversations, when we know in our heart of hearts that the enableism is alive and well in this mother, and yet we let it go. And we return that person back to that family system that we know is probably not the best. And that's a hard lesson to learn. I had to learn it myself. And it's tough. So I know the reality of that. That's why I started Bridging the Gap. That's why I wrote the book, because I'm so passionate about this. We've got to do something. We're losing too many people.
This is a life and death struggle now. I won't even ask for a show of hands, but in any of the treatment centers out there, have you noticed an increase of overdoses and death in the last 5 years? Yeah. Do you think it's going to get better? No. Is there more hopelessness with the late stage adolescent? Is there more ambivalence? Is there more fear in the parents? Is there more need to control? All of these things are what I see every day. That's another reason why I took this incredible leap of faith to leave a job I'd had for 10 years that paid the bills real nice and start my own business, because I just couldn't live with it another day. We got to do something. And the something I came up with was this very simple. Some clinician friends of mine are saying, oh, we know all this stuff. Yeah, but I'm not talking to you. I'm talking to the parents. I'm talking to the husbands and the wives. I get you get it, but somehow you getting it and them getting it ain't getting it all together. So we got to do something different. We got to come up with a clearer message. Walt Disney, of all people. We have a bunch of Disney workers in our house, so it's interesting to me. I've learned so much about him. He made this statement years ago, and the 4 C's are the things that really hit me. When he said, somehow I can't believe that there are any heights that can't be scaled by one who knows the secrets of making dreams come true. The special secret that comes to me can be summarized in the 4 C's. And the 4 C's I go into in the book in great detail. Curiosity, confidence, courage, and consistency. And he says the greatest one is a confidence that you will get better, that it will get better. You got to hang in there with it. You can't give up. We can't give up on the families. We can't give up on addiction. We've got to keep moving forward and understanding that the parents, more than ever, are an integral part right now, because you have a lot of late-stage adolescents in your treatment program. Some statistics say now that it's up to 34 years old, and they're still considered to be late-stage adolescents. So it's increasing, it's not decreasing. How many, you just see that, this inability to launch, as they call it, failure to launch. So these 4 C's, to me, the big one is consistency. We have to bring consistency into it. So I've borrowed some of the old school things, what I always get a kick out of conferences when we say evidence-based. There's some really old evidence-based information out there. It was written in the 1930s by a couple old drunks. And you know what? I can't give you statistics, but I can give you thousands of people that are doing it every day. I can take you to live statistics. I can introduce you to live information, how lives are impacted and changed. So I don't want to throw the baby out with the bathwater. I just wanted to kind of freshen it up a little bit and keep all this new information that we have, all this great tools that we're learning. And it's sad because we have some with the medications that are out now to help the young addicts. I've had 2 psychiatrists tell me, Bill, I'm reluctant to give these young adults, these late-stage adolescents, that medication, because what's happening is they're going out and they're injecting more drugs into their system and they're overdosing. Now, here science has come up with something that may help. And we're afraid, these doctors are afraid to give it to these kids because they're so enabled that they have the money and the time and the wherewithal to buy so much drugs, to put so much of the stuff back in their system that the doctor won't give them medication because he's afraid they're going to overdose. And it's a fact. It's nobody's fault. That's how bad it's gotten. So we need to look at this thing. And this is the first time I took things from the book and brought it out. I felt a little disjointed just because when you write it and now talk about it, it's kind of interesting. But there's a passion for it. I'm available to come to your treatment centers. I've started a webinar online that I can work with families across the United States. And we're just going to take this out and see what we can do to get this very simple, direct message of enablism out to the families. And all of your support and attention to this would be greatly appreciated. Thank you. Any questions for me? Any comments or anything I can clarify with you? It will be available on Amazon in fall. We'll do a push when I actually get it's in the second edit now, and then it goes to the author. So so we're getting there. I'm looking at fall, September, October, and then I'm hoping that some treatment centers will back a few talks and then make some books available. But it will be through Amazon. LinkedIn will have information on it. I'll be doing more talks, and so it'll be available. I'm going to try to do some online internet radio and things with it too to get the word out. So thank you. Yeah, and it'll be available. Any other questions or thoughts on it? Again, I appreciate this is interesting doing it for primarily people in the field. So I appreciate your attention on this. I know I haven't told you anything new, but the idea is we got to talk to the people that don't do this every day. They're the ones that need the message. So you can see.
How do you work with treatment centers?
Well, thanks. A couple different ways I can do that. I'd love to be able to come out and take all of you, the treatment centers here and that I've talked to have great family programs. But even a great family program can use a little boost. So I can come in and present in your family program to your families. I can be available to do that. If they're leaving treatment and the families are out of town, and after they leave your program, I can work with them online in conjunction. So the family will be my client, not your patient. So there'll be a line there because I don't need to blur the lines any more than the parents already do. So I'll be working with the parents, hopefully to take some of the heat off the clinicians dealing with the addicts and alcoholics and teaching them enablism. So I can do that.
So we could refer families to you?
Mm-hmm. Yeah, they can, like I said, we can go right online. I have GoToMeeting.com. I teach drug and alcohol counseling online plus live, so I'm very up on being in front of the camera and doing the virtual teaching, because it's virtual, we'll talk. Mm-hmm.
How would you coordinate with the training programs if you're going to do that? Like if you're working with the families, how would you make sure that, because obviously it's pretty vital what you would be doing, but for the clinician or for the people that are working actually with the patients, how would we work together?
It can be as little as just confidentiality signed and as needed, or it can be as much as obviously confidentiality signed and me working closer with the family. I'm sorry, with the treatment team. It depends on, sometimes what I've been finding is some of the clinicians say, let's just do the basics, but I'd really like you to work with this family and kind of, take some of the heat for me, and then, we can work together on it. But it's whatever, we can adapt it any way we want, but my primary client would be the family. That's who would be paying me and who would be working with me. I've had one treatment center approach me about maybe putting it on staff and making it available, but I don't know if that'll work. This is all pretty new, this idea of taking this out to the families. My first idea was just you call me up, I'll come out and speak to your family. And then this whole internet thing started coming in. Yeah, because people ask for it. So, because their families are back in Iowa and they won't come out. Right? They don't want to come out. So that's one way.
Most of our referrals are from, and a lot of the treatment centers now are national.
Yeah.
Because of the internet.
Sure.
So the families are on the other side of the country. That's great.
And so we can work with them online as a supplement to your family program. At Newfound Life, where I just left, we do a family program at the end of the month. Jerry knows about it. And we have great attendance. And I think the reason why we do such a good job with it is because of, we've been doing this enablism without knowing what we called it. Well, we're on the phone with them, we're encouraging them to come in. We have them come out for a weekend once a month. I would meet with them and do this whole enablism talk with them, and then the next day they go into a bigger forum with professionals throughout the United States, where we had all kinds of authors and professionals in the field would come, and they would get a lot of information and education in addition to the counseling. But it was a very focused, it still is, it's a very focused based program. So I would encourage to look at Newfound Life in Long Beach. It's just a little program in there, like 22 years. But they do a great job with the family. I've had many programs say, how do you get so many people with this thing? It's packed. We strong arm them. We make them an offer they can't refuse. And if you know the owner, if it's possible. So anyway, yeah, that's enableism. Any more questions or anything? No?
Thank you so much.
Oh, you're welcome.
We're gonna do our raffle now. And
We also have, Bill, did you write an article for Recovery View, our
Yes.
online journal?
Yes, yes.
And so his book, as soon as it's published, it'll be featured on Recovery View and the book club.
Oh, yeah.
So we'll help you get it out.
Yay.
Yeah.
I'll be knocking on your doors with it, I think.
Yeah, well, we welcome it. Samir, yeah, we need it. Samir's going to help us with the raffle. What do we have, Samir? We have
we have from ATS a Barnes and Noble gift card. Okay.
Ooh.
And David Mallow.
Oh, David Mallow.
Okay. $25 worth of Starbucks gift cards from
Ooh.
Sovereign Health
I'll take that.
are going to Michelle.
a lot of coffee. Fun. Okay, thank you everybody for coming. And don't forget our next luncheon with Richard on July 10th.